Welcome to this video on acute liver failure. We will explore two challenging cases and the lessons learned regarding native liver recovery and emergency liver transplantation at Venkateshwar Hospital. The landscape of liver disease is evolving rapidly. We now encounter a diverse spectrum of conditions, from metabolic and alcohol-related diseases to acute liver failure. Addressing these complex cases requires a comprehensive, multidisciplinary approach. Our integrated liver program at Venkateshwar Hospital provides end-to-end care. This includes specialized hepatology, HPB surgery, and liver transplantation, supported by a dedicated ICU, interventional radiology, and comprehensive support services like nephrology and long-term follow-up. Our purpose-built 7-bed liver transplant ICU is essential to our care model. 5 beds are dedicated to transplant recipients, while 2 are specifically equipped for managing the rapid needs of patients with acute and acute-on-chronic liver failure. This video examines 2 patients who follow different clinical pathways. Despite their unique presentations, our team remained focused on the same critical objective: saving a life through timely, expert decision-making. By the end of this video, you will better understand how to recognize patients needing early referral, the concept of the golden window in treatment, the value of multidisciplinary ICU care, and when transplantation versus native liver recovery is the right path. Acute liver failure is defined by acute hepatic injury, coagulopathy, and hepatic encephalopathy in the absence of pre-existing cirrhosis. It is a rapidly evolving, yet potentially reversible disease that demands specialized ICU care. What makes ALF unique is how quickly patients deteriorate, often over just hours or days. Clinicians must navigate challenges like cerebral edema, hemodynamic instability, and multi-organ failure within a very narrow therapeutic window. The golden window is the critical opportunity to intervene before organ injury becomes irreversible. Early referral is vital, as it enables advanced organ support, dynamic evaluation, and the possibility of immediate transplantation if it becomes necessary. Our management algorithm begins with the identification of suspected ALF, followed by immediate transfer to the liver transplant ICU. From there, we provide aggressive organ support and daily reassessments to determine if the patient can recover or requires an emergency transplant. In our first case, a 19-year-old female presented with hepatitis A-induced acute liver failure. She experienced rapid neurological decline and progressive multi-organ failure, initially making emergency liver transplantation a serious consideration. Managing this patient presented major clinical challenges, including severe encephalopathy, the need for vasopressor support, CRRT, and plasma exchange. The patient was at an extremely high risk of death. An unexpected turning point occurred when the family requested to take the patient home. However, while near the lift, she suffered a cardiac arrest. Our team performed CPR for 18 minutes, successfully achieving return of spontaneous circulation. Following the arrest, our intensive care strategy focused on aggressive neuroprotection, targeted temperature management, mechanical ventilation, CRRT, plasma exchange, and high-dose vasopressors, all paired with continuous neurological assessment. The result was a remarkable recovery. The patient's neurological function returned, organ support was discontinued, and her native liver function normalized. She was eventually discharged home, neurologically intact. Case 1 offers vital learning points. Never abandon hope solely because transplant criteria are met and a donor is unavailable. Serial reassessment is essential, as some patients can recover despite extreme illness. Our second case involves a patient requiring an emergency liver transplant due to acute liver failure. The patient exhibited progressive multi-organ dysfunction and experienced rapid clinical deterioration, necessitating the decision to proceed with an emergency transplant. The perioperative phase was a race against time. The patient arrived at the LTICU with renal failure requiring CRRT, severe coagulopathy shown by a flatline TEG, ventilator dependence with encephalopathy, and multi-organ failure. We provided dynamic optimization while simultaneously performing the donor workup. Intraoperative challenges were significant, including severe coagulopathy managed by TEG-guided transfusion and factor concentrates. The surgery involved a difficult hepatectomy, with a prolonged anhepatic phase and IVC clamping requiring a shunt. Additionally, we managed acute lung injury and acute kidney injury. The post-transplant ICU course required ongoing CRRT for persistent renal dysfunction, followed by gradual recovery as graft function improved. The patient successfully weaned from ventilatory and vasopressor support. Despite developing ICU-acquired weakness, intensive rehabilitation led to a full recovery and discharge. The take-home message from these cases is that this was more than a transplant. It was a continuous multi-organ rescue effort. Success was the direct result of meticulous critical care, anesthesia, surgical precision, and multidisciplinary teamwork. This scene is intentionally blank to allow for reflection. What made the difference? Key factors included early referral to our center, the use of a dedicated liver transplant ICU, consistent daily reassessments, strong multidisciplinary teamwork, and the ability to provide the right treatment at the right time. To summarize, acute liver failure is a dynamic condition where early referral saves lives. Not every transplant candidate requires surgery, but delay can cost both a life and the opportunity for a life-saving transplant. Advanced ICU care is a game-changer for outcomes. We extend our deepest gratitude to the entire liver transplant surgical, anesthesia, critical care, gastroenterology, nephrology, nursing, and administrative teams, as well as the blood bank. Most importantly, we thank our patients and their families for their trust. Thank you for watching this video. As we have seen, acute liver failure is truly a race against time. One patient survived because we knew when to transplant, while another survived because we knew when not to give up.